That is okay. All right, everybody. It is 5 o'clock. We're here again. I know it's felt like we have done this so many days, but it's this type of persistence. It's coming together every day at 5. It's making sure that we are committed to defeating this coronavirus that is going to get us through this, that is going to make sure that we win, that is going to continue to save lives, and it's going to be one of the reasons that we pass this test of humanity. I'm very proud of the job that each and every one of you all are doing. And while we are not through this challenge, we know that there is light at the end of the tunnel, and that if we continue to work as hard as we can to flatten that curve, that we absolutely will come out of this, and I believe we will come out of this stronger. So let's make sure we say it and we believe it. We will get through this. We will get through this together. We will get through this. We will get through this together. One last time with me. We will get through this. We will get through this together. And we will get through this because we will keep doing those 10 steps to defeat the coronavirus that we've done every day. I know you feel like you have done it a lot, and you have, and that is why we are in the spot that we are in. The moment we stop doing these is when we see spikes in cases and we see our Commonwealth losing more people than it should. You know, the challenge of our times isn't supposed to be easy. It's not just that we go through some hardship for a month and then we say, okay. You know, the challenge of our times, if we're going to be a great generation and we look back at what the greatest generation went through, sure. You know, we're going to hit the time where we feel like we have been at this a long, long time. They spent years. We just need months. So again, let's make sure that with all the noise out there, that we remain as committed as we have ever been, because we are more united than we have ever been. Even with a little bit of news out there about those that don't believe this virus is real, we know. And we are together, not Democrats or Republicans, just Americans fighting this coronavirus. And you know what? We are together as Kentuckians. And I think we're doing a better job of that than just about anywhere. So your 10 steps, I'm not going to belabor them today. Healthy at home is the most important step. If you're not at work, if you're not getting essential supplies, if you're not getting exercise, we need you to be at home. The more you stay at home, the more people that you protect, the fewer deaths that we see, and the safer our frontline healthcare workers are. Healthy at home. Avoid crowds and gatherings. Again, no exceptions. No exceptions. We will find safe ways for people to do all of the things that we would typically want to get together and do. But every crowd spreads the coronavirus and risks the death of someone that probably wasn't even there, that didn't make the choice to ignore the guidance. So let's remember how important that is. Practice your social distancing. Know when to seek care. You all have been champions in this. The reason we have not exceeded our healthcare capacity is because Kentuckians have done their part, have understood the guidance, and then our healthcare system, just like our businesses and individuals that sadly aren't going to work right now, have made amazing sacrifices. We would have had our healthcare system overwhelmed long before now, but for our actions as a people. But we got to keep them up, because remember, we're still in the midst of this. So we got to keep that going. But once we know something's working, once we know it's helping us win, isn't that something that we keep doing and we make sure that we do what it takes to get through? kycovid19.ky.gov. Make sure you're washing your hands, disinfecting services. Sign up for benefits. We will have another update this weekend on unemployment. But I'll tell you, I will likely do that myself, or we will Skype in the Lieutenant Governor. Our folks in unemployment are working hard. I know it's taken them time to get to everybody, but we had somebody's property, their car vandalized here recently. Our folks here in government are doing the very, very best that they can. They're working as hard as they can. I know it's taken too long. I know people are frustrated, but these are public servants working absolutely as hard as they can. Prioritize your mental health. We don't just want to get through this and through this together. We want to get through this strong, ready to restart our economy, ready to do so much in Kentucky that we have always dreamed about. I didn't run for governor just to try to get us through a pandemic. In fact, it's something that I could have never foreseen. But I'm still committed to advancing public education, to creating more opportunity out there for people. We're going to do it. If we can defeat a worldwide pandemic, and we can not just flatten, but seriously flatten a curve, folks, we can do anything else, especially if we stick together in the way that we have. Don't travel, just don't travel. And finally, report noncompliance. We always talk about our 10 steps plus one. You gotta fill out your census. And you know what? We had, and were recognized by the census as the #1 state in the South for our response. That's a big deal, but we are still 17th. I know you want to be better than 17th. Again, just about 3%. 3% of Kentuckians said if you got online tonight and you filled out your census, it takes 20 seconds. Somebody asked me to mention that. I mean, it doesn't take long at all. If you get online and you do your census, we could jump into the top 10 if just 3% of Kentuckians made sure that they got it done. And remember, federal funds are going to be really important to restart our economy. And we never know if they are going to be divvied out in manners that are determined by the census. Let's make sure we do our part. Let's make sure that we get those federal dollars coming in. And the other thing that we ask people to do every day, is to make sure that we can fill up social media, showing the example of the good people we are. We started off more than a month ago talking about being good neighbors. And the example of being a good neighbor that you all put on social media every day encourages everybody else to be a good neighbor. And it shows you that we are united. We are absolutely together in this, and we've asked you to use Team Kentucky, Together KY, Patriot, and Healthy at home. So here's a little bit of what we have today. All right, this is Maysville Community Technical College. Again, we have seen more businesses, more households light up green. We have seen different groups willing to deliver green lights. This is how we show the families who have lost people that we care about them, because we do. We absolutely care about you. We know losing somebody during this type of pandemic comes with its own challenges. It's a color of compassion, but it's also the color of renewal, knowing we're going to get through it and we're going to be able to come out of it in a way that is not just going to rebuild our economy, but I hope to take these positive steps that we have taken as people and coming together and making sure we carry that forward. A better world. All right, this is Kelly Construction, and as you can see, talking about getting through it together. Putting this up tonight because we're going to have a new normal coming out of this until we have a vaccine, and we're going to talk about it. It's going to take changes by us as individuals and how we do things. And while coming out of it is going to be very gradual, it's going to take a lot of changes by employers as well. And I thought that this was a really good example by Kelly Construction, just knowing what we're facing and how, as we come out of it, there are going to have to be some steps that we take. Oh, I thought this was great from the Litchfield Fire and Rescue. Our first responders have been incredible throughout this, knowing that they may be exposed to this coronavirus, but rising to the occasion. We appreciate them. All right, so this is Sydney's grandfather's 65th birthday. 65 is an important year. I remember, well, they're not going to like me for saying this, both of my parents' 65th birthday, and how special it was. But look, she celebrated it on a Zoom call. That is her protecting her granddad. That's exactly what we need to continue to do. These are special moments that we're not getting to experience the same way, but we're making the sacrifice for a reason. And I thought this, again, is just special. This is in Fort Thomas. We see so many making sure that they take the steps to recognize those we've lost. Just a symbol of compassion, a symbol of unity. And the chalk art has been amazing, recognizing those heroes that are out there, especially those on the front lines. And this next one, we showed you a video yesterday of the enthusiasm for when someone recovers. What about the enthusiasm for our frontline healthcare workers? We say they're heroes. This clip, which is U of L Healthcare, shows that they are sometimes treated as heroes too. Well, and I hope that all of our healthcare workers out there know how special what they are doing truly is, and that we care so much about them. So one of the things that we have started doing in the last couple days is learning a little bit of sign language. It's a step as we have come together as people, as we have cared about each other, as we have modeled kindness and realized that this is a test of our humanity. How much we care about people we've never met determines how well we do in this. Virginia has shown us the importance of including everybody, absolutely everybody. So we've been learning a little bit of sign language every day, and we've been trying to do it a little better every day. And Virginia let me know that the right way to do this is for her to teach us from where she is right now. And so our word of the day that we're going to learn is compassion. And we appreciate that, Virginia. Okay, we are going to go pretty fast so that we can get to both going through the president's plan that he put out yesterday, as well as our own indicator guidelines that we're going to be relying on timing of when and how that we can begin to reopen our economy. First, a testing update. The Kenton County site today that's providing drive-through testing, that partnership with Kroger, and then our contract with Gravity Diagnostics and UPS tested 212 individuals today. We are seeing the numbers that are tested going up. That's a real positive. We want to get the most tests that we can out of all of these facilities. So again, on Kenton's going to run through tomorrow, and then on Tuesday, we have 4 sites opening up, and if we can put up how to sign up for them, that is Madisonville, Paducah, Somerset, and Pikeville. And you got to fall in the criteria. Again, that's on the website, but you healthcare worker, first responder, symptomatic, or in those especially vulnerable population. Let's make sure that you get online. Remember, in any of the area in Madisonville and Paducah, that covers a lot of Western Kentucky. If you're in the Purchase, certainly sign up for Paducah, and then Somerset, South Central, Southern Kentucky, and Pikeville and Eastern Kentucky. Let's make sure you can sign up, and they'll give you a date on Tuesday, Wednesday, or Thursday, because we're trying to get them in in those dates. And then this coming Wednesday, we'll talk about the next set of sites. They've been chosen pretty specifically, and there's going to be a plan around them to try to address some of the inequalities and the healthcare outcomes that we're seeing. So again, Madisonville, Paducah, Somerset, and Pikeville, and all the surrounding areas, make sure that you go online, start signing up now through Monday. We want to make sure that we maximize the tests in your regions. Also, want to make sure I give a shout out to our Kentucky public school system and everything that they have done to feed our kids. It is nothing short of amazing. So in their Meals for March, which is March of this year, just fed during the month of March, 4,656,897 meals served to 230,000 children. To everyone out there who helped, to those school systems, thank you. Thank you. Our kids, thank you. Thank you for again, passing that test of humanity. You are amazing. We appreciate you. You do amazing things even in a year where we don't have something like the coronavirus. But just look at how you have responded. So to all of you, thank you for protecting our most vulnerable during this. All right, today we're going to go ahead and do our update on cases so that we can then move into some of the planning. So today turned out better than I thought it would coming from yesterday. As it turned out, a number of the cases that I thought we would see today were second cases of people who were recovering. In other words, they already had tested positive for the coronavirus, but to recover, having to have those next tests to show that you are now negative. So our total number of new cases today is 134. And while that is high compared to a number of other days, I expected it to be much worse. So that is, all in all, a good sign. That brings our total number of cases, again, after we adjust every day on duplicates and folks outside of Kentucky, to 2,522. Total number tested, 30,596. And one of our challenges here is some labs are taking 10 days to get the results back. And so, we talk about how many people today have tested positive. Well, one lab might have a 24-hour turnaround. One lab might have a 48-hour turnaround, and the other one is 10 days old. So know that's inside the numbers. It's something we can't control from the labs, but it doesn't just reflect one point in time. What it reflects is the testing that has come in. Folks ever in the hospital, 1,008. Folks currently in the hospital, 360, and that's down from yesterday. Ever in the ICU, 514. Currently in the ICU, 227, a little bit down from yesterday. Ever recovered, 979. New statistic today, the average age of someone that has contracted the coronavirus is 52 years old. So while we talk about the most vulnerable population, anyone and everybody can get the coronavirus. Speaking of which, yesterday I announced we had a 10-day-old baby that had the coronavirus. Well, today that 11-day-old baby is home. And from what I'm told, is doing okay. That is really, really good news. We'll try to keep updating you with the updates that we get, but let's remember that child's still dealing with this virus and everything else that a newborn has to deal with. So let's think about that child and their family. New cases by county, 24 in Butler. These are some of the cases from that long-term care facility, I believe, that are coming in. 9 from Kenton, 8 from Hopkins, 7 from Boone and Jackson, 6 from Christian, 5 from Warren, 4 from Graves and Jefferson, 2 from Boyd, Campbell, Davis, Fayette, Grayson, Hardin, Harrison, and Muhlenberg, and 1 from Allen, Boyle, Breckenridge, Caldwell, Callaway, Franklin, Grant, Hancock, Jessamine, Knott, Knox, LaRue, Laurel, Lincoln, Marion, Mercer, Oldham, Pendleton, Pulaski, Rowan, Scott, Shelby, Simpson, Trimble, Webster, and Whitley. So again, as you can tell, it sounds like I'm just reading every county in Kentucky. And that's because the coronavirus is in every county of Kentucky, whether there is a specific case that's been reported or not. Today, I'm sad to report we have 8 new deaths. We continue to lose people to this coronavirus. It comes for those that are in the most vulnerable populations to us. Let's make sure that we light our houses up green again. These 8 families are just as important as every other family that we've lost. It brings our total number of deaths to 137. Those are 137 Kentuckians that are loved by their communities, and it's 137 losses to all of us. The new deaths include an 80-year-old female from Jefferson, another 80-year-old female from Jefferson, 64-year-old male from Jefferson, 83-year-old male from Russell, 93-year-old female from Graves, 96-year-old male from Russell, 73-year-old male from Jefferson, and a 49-year-old male from Muhlenberg. So let's make sure that we remember all of those that we have lost. Breaking down race and ethnicity, we know the race of 76.38% of all positive cases. They are 79.3% white, 12.33% Black or African American, 3.43% Asian, and 4.87% multiracial. Ethnicity of overall cases, we know about 70%. They're 93% non-Hispanic and 6.89% Hispanic. Of the deaths where we see the greatest disparity, we know 81.75% of cases 81.75% of deaths. We know that data. There's 77.68% white, 21.43% Black or African American, 0.89% Asian. So again, it's troubling, and I hope that not only we do what we should to address this during this outbreak, but I really hope that when we come out of this as better people, which I hope we do, that addressing inequality, especially in access to health care, is something that we finally come to the table and get done. All right, updates on a couple of facilities that we routinely talk about. Let's start with Western State Hospital. The best news there is the numbers are the same as yesterday. No new cases, no new deaths. That is positive news. Green River and more broadly our correctional institutes. We have one new staff member, and we actually have one new death, which is shown up here. We're making taking a number of steps in Green River, and we're glad that while the numbers of positives only went up 1 on the staff side, we hate the fact that an inmate, an offender, was lost. So this morning, an offender from the Green River Correctional Complex passed away in the hospital after battling COVID-19. 49-year-old male was admitted to the hospital on April 8th and tested positive the next day for the coronavirus. His family has been notified. The offender was serving a 9-year sentence out of Jefferson County for assault second and escape second, and had approximately 3 years left to serve on his sentence. Kentucky Department of Corrections has approximately 12,000 incarcerated offenders in 13 prisons and 4,000 employees. Currently have 19 inmates and 15 staff who've tested positive. 5 have recovered. The agency also supervises about 50,000 offenders in the community through probation and parole. Kentucky Department of Corrections is working closely with our public health department and is committed to following CDC guidelines. We're also announcing today that in the Hazelwood facility in Jefferson County, we have 3 residents and 3 staff that have tested positive for COVID-19. And Roeder and Oldham County, we have the same as we had yesterday, just the 1 staff member. And then finally, in our long-term care facilities, Again, this is one of the populations that is most at risk. And we'll talk as we go through our plans and the guidelines and when and how we loosen restrictions, we open up our economy. Our ability to protect those in our long-term care facilities is absolutely critical. So today we're reporting 30 new residents and 10 new staff have tested positive for the coronavirus, with 5 new deaths. This is the real challenge. We are seeing it all across the Commonwealth. Tomorrow, Secretary Freelander is going to specifically talk about steps, new steps, because we've taken steps, but new steps we're taking to care for those who are counting on us. Now I'd like to invite Dr. Stack up. We are going to tag team this. He's going to stand on the other side of the screen. We're going to do 2 things. The first is we're going to go through the President's plan, because there are a lot in that that we're already in our plans on how we reopen Kentucky's economy. And then we're going to go through some specific guidelines we're looking for. But first, let's talk about our partners. We announced 2 days ago that we would be working with Ohio and Indiana to make sure as we made these decisions, we were coordinating with other states, we were talking, and that we could not only better protect ourselves through that, but the ability to rebuild the economy would be faster. Yesterday, we announced that that partnership had grown significantly. These are the states that are involved. These are states led by Democrats, Republicans. You know, it's a group of states that I believe are just looking ultimately to do the right thing, and I believe our coordination, again, is going to help with better results on the public health side and better results on stimulating the economy. So let's start with now what the president put out yesterday. He had briefed me and all the governors on a call on it just before we started. And let me say that the document itself is a public health document when we look at it. And that I don't know what the rhetoric is going to be out there or what's going to be said or tweeted, but the actual contents of this document have a whole lot of what we were already looking at. And so we believe that our approach, which we're going to be talking about today and then more in the coming days, is very much in line with the White House. So don't let people try to create divisions there. I mean, we're going to use the actual pages put together. This is all public health officials on the federal and on the state side and everybody else just trying to do the right thing. So a couple things about the president's plan. First, a lot of attention went to the phases. You know, there's going to be, and it's gradual. It's very gradual. Phase 1, you know, is groups of less than 10 people when you can get there. Phase 3 is very different from that. And so it is looking like we were talking about slowly doing things as we can make sure we protect people. But even before the phases, the plan put out by the White House has certain thresholds that states should meet. Almost certain suggested requirements, because it's just recommendations, that we should meet before we start taking some of those steps. So let's go to the next page. There are a couple, now this is our benchmarks. If we could go back to the president's slide deck. There we go. Here are some of the things they said. You need to get these in place. And let me tell you, I'm not sure any state has them in place today, regardless of the decisions we make, they make. But he said, the White House has said, you need these in place before you move to phase 1. And a couple of important things to point out. And here's one. You know, number one, what they're looking for is a decrease over 14 days, which they're talking about, in cases. So when you think about the curve, right, and trying to flatten the curve, and you know what? I think we've almost cut the top off that muffin, right? That we're in a kind of a plateau. What they're looking for is not that you're going up, not that you are in the plateau, but you are truly going down, less cases day after day, and an actual trend. So, Dr. Stack, you want to talk about what we'd be looking for there?
Sure. So the governor shows on a regular basis the St. Louis versus Philadelphia slide, and it shows the big hump. It's a tall spike. And what we wanted to do is to flatten that spike. And like he said, I think we can claim some success. I think we've cut the top off of that mountaintop or off that muffin. What they want, though, is not only to be a flat plateau, they want us on the downslope. They want us on the downside of that mountain or that hill so that we know that we are actually in a recovery period and we're not likely to have, at least at that moment, a resurgence. So a 14-day downward slope is a significant hurdle. And if you look at our data, and we are one of the best states on some of the publicly reported data when adjusted by population, we still have not yet had a downward trajectory. At best, we are a flat plateau.
And I think they were trying to help with your volume. Can you show how about the COVID Act now? Because that'll have the same hump. Okay, so what Dr. Stack is saying is we can't be going up, we can't be at the top. We have to have proof that we are actually going down. When we talk about what we think Kentucky's doing, which I think is better than any model we've seen, it's slicing through that upward part, but still the number one thing that the White House is saying that we need to see that will give us guidance is 14 days of actually coming down.
We've got to be over here. We've got to be on that far right side.
Okay, can we go back to the slide deck from again the White House? All right, so that's number one. What they're talking about. Number two, when he comes back, is just to the other side of that, and that is talking about a decrease and ultimately no patients that are cared for outside of kind of our normal healthcare system. So not seeing patients in state parks and field hospitals or in hotels.
So what we need to do is one of the big reasons we've done this is to make sure that the existing healthcare community has the capacity it needs to care for all the patients who need care. So what the president has suggested here, I think we would agree with, that the existing healthcare community, that means hospitals, clinics, doctors' offices, have to have the capacity needed to treat both all the folks who regularly need care, and also we'll add they have to have the ability to have a surge capacity so that if we have a resurgence or return of the disease, which we'll discuss a little bit later is a very real likelihood, that we have to have the capacity within the existing healthcare system to provide those needs.
So number one, and again, this is from the White House, 14 days going down. Number two, to make sure we're operating well inside our normal healthcare capacity and that we can prove that. Number three, they've got, which is the bottom right as you're looking at it, which is robust testing for our healthcare workers, for those who are taking care of people who may have the coronavirus, or as we want to open up healthcare, making sure that those that are providing other services outside of it are not spreading the coronavirus.
Now my volume is fixed. So this is now a real problem still. We have laboratories who are coming online and able to do tests, but we don't have the little swabs. I showed you that one day here at one of these events. We don't have the swabs we need to do the test. And so what we have to have is not only the current capacity, but the proposal actually, and we'll show this on the next slide in a minute, actually requires us to be able to test at a scale that no state is testing right now, and with a frequency over and over and over that no state is able to do right now. So we agree with this. We need to get the testing capacity rapidly up so that doctors and offices and hospitals can test whenever they need to a much larger number of people.
All right, let's go to the next page of this. And let me just check because people are watching. Can people at home hear? Okay, good. More so him than me. All right, so again, these are all preparedness. These are all the things that we need to make sure that we have in place so that we don't put people in harm as we lessen those restrictions out there. And look to the left, testing and contact tracing. The White House is saying that every state needs to make sure they have significant testing capacity, and then the ability to get back where we haven't been in a little while to when somebody has been rapidly tested, tracing all their contacts, ultimately isolating those that have come in contact. And that is not just being able to test everybody who is symptomatic, not just first responders, not just those that are in the danger zone, but everybody who's symptomatic, but also everybody who is in the danger zone, even if they are asymptomatic.
Right, so this means if you are going to go in for a medical procedure, a colonoscopy, an endoscopy, a surgery, probably you need to be tested before you have that procedure. Things you wouldn't have normally done, you're going to have to do. To put this in context, if we just tested 0.1% of the total population, we'd have to do 13,500 tests a day. That's the math I did this afternoon for a different phone call. And we've only done 30,000 or so tests already. So just to put that in context, we would exceed in 3 days the total tests we've done over the last 6 weeks. And then we have to do something that the public across the United States of America is going to have to get used to. If you have a positive test, you're going to have to work on self-isolating for 14 days, having us work with you to identify the people you've come in contact with, and having those people self-isolate, because we're going to have to work very hard for quite a while ahead to contain and prevent another resurgence.
And that's going to be part of our new normal. The fact that we want to open up, we want to start getting back to some of the things we were able to do, but at any time, somebody can test positive and you can get a call because you were in contact with them, and suddenly for about 14 days, life won't be normal again until you can get out there. This is part of, again, what everybody and all the health professionals say will be a part of our new normal until an effective vaccine or other treatments come out. All right, so decrease in cases, 14 days, making sure we can take care of everybody inside the normal healthcare system, robust testing for healthcare workers, significant testing and tracing for the public. Next one is PPE. It's the ability to overcome the dearth, the difficulty in getting PPE, especially on the private sector or healthcare side.
You've heard us talk about this on a regular basis about personal protective equipment. At this point in time, every hospital and every other healthcare entity in the state of Kentucky who wants PPE from the state has to report every day at 10 in the morning their availability of PPE, their burn rate, and then we have to push that up to the federal government. In order for this plan to work, and again, there's no politics in this, this is the federal proposal from the White House, we have to have the regular supply system independently supply sufficient personal protective equipment. That means hospitals and clinics and doctors have to be able to procure their own materials without having state and federal government be the intermediary who makes that possible. That's not currently possible. We're working towards it, but we're not there.
And a couple things we've talked about as we've gone. We have to have the ability to handle a surge, especially in the ICUs. We have to be able to protect those in our senior living facilities. Have to. Even when you look at the phases, once we get to them, everybody in the risk zone under the federal proposal is still sheltering in place. I mean, it's while it is gradual and there is reopening in the proposal, I mean, it's still going to be pretty tough on a lot of our people in order to protect them. And finally, and this is one that Dr. Stack made sure that I would cover, is that we got to be flexible. We've got to be fluid. The White House is saying that as you open up, you may see spikes, you may see changes, and you got to be able to respond.
So one of the things we have to be prepared for, and we'll continue to remind you of this in the days and weeks ahead, is because this infection is one that very few people have still been exposed to, and that's good because it's very dangerous if you're in the high-risk population. When we don't have a vaccine and we don't have a treatment, once we stop some of these steps we've taken, we're going to see an increase in the amount of disease in the community. And in order to do that with the least harm possible to people, the most vulnerable still have to be protected, and everybody else has to take steps that help them be protected, even though we start to return to some of the former activities we've done.
Let's move 2 pages forward if we can, James. Guidelines for all phases of individuals. So just wanted to point this out, that as we are being able to reopen, it does not change what we need you to do on the personal hygiene or really even the social distancing. It's going to be that much more important. We're still going to have a very dangerous disease, virus that is out there. It's still going to be very contagious. And so everybody's going to want to think, well, we can do that one or two extra things. We don't have to wash our hands as much. We don't have to wear the mask. We don't have to, no. We're going to have to do it almost twice as much. It's going to fall down on significant personal responsibility. And again, we're going to have to be really good neighbors as we do it, because one person not being hyper vigilant in when we loosen and as we loosen the economy could cause that spike that makes us have to step back again, and we don't want to do that. And can we go to the next one? This is something, as we're trying to meet those prerequisites, those benchmarks that the White House talks about, that we also need, James, one more, on employers. It's going to be a new normal in our places of work as well. I mean, if you look at this, social distancing and protective equipment, we need to get to a place where we have PPE not just in sufficient supply for our healthcare, and we're going to be talking with our healthcare community a little separately, because once they have enough PPE to withstand a surge, we want to be able to open them up to be able to do some different things, get people healthy, make sure their systems are coming up. But also in our industries, we're going to need social distancing, protective equipment. Coming out of this, we're not going to be able to have the old normal. Even in every work environment, every one, we're going to have a new normal. And we're going to talk, I believe, on Monday about some internal teams that we're putting together that are going to be working with industry to get some of their plans, and then to go back with them probably for other things that we need to do, to have them vetted by public health so that we know that we're going to do things as safely as we can. Look at this second one, temperature checks. So employers, as you're out there, still knowing that we got to meet those metrics before we can move into to phase one, or the first steps of reopening the economy, you got to be ready every day to provide temperature checks to your workers. That's the way, on the way into the building or the site, that we make sure that we don't have people that are symptomatic. Remember, asymptomatic's a problem too, but certainly symptomatic that are spreading the disease, spreading the virus. Testing, isolating, and contact tracing. It's not just going to be a Kentucky Public Health and our public health department's jobs around the Commonwealth. Major employers are going to have this capability too, working with us. And I know we've looked at the rest of it. Let me just point to the bottom. Travel is still going to need to be significantly curtailed. And so we've done that for the beginning, but we ought to know even in business coming out of it. And let me just point out here, and it'll be in a couple other slides. If you are a business that can survive on telework, you ought to continue doing it. If you can telework, especially until we get further along with this, your business is going to be better off. You're going to have less likelihood of losing a portion of your workforce to being quarantined. It's certainly what is best for your employees. Let's go just a couple slides into phase one, and we'll talk through other phases. Again, these are guidelines, but I just wanted to show a little bit of, under the White House's plan, how things are gradual, and they certainly don't change overnight. Can we go two more? Yeah, into phase one, individuals. Right. So again, this is White House's guidance as you reopen the economy, which I think is important because we agree with a lot of this. And it's important for folks to know out there that to us, this isn't political. It's life and death, and we a lot of us are on the same page, regardless of rhetoric that gets out there. Number one, we ought to know as this comes out, our vulnerable individuals. Look at the words the White House is using. Should still be sheltering in place. Individuals when in public. Even this is when we get to the point, those guidelines where we can contact trace and all. You're still looking at significant social distancing, and groups are 10 or less. So just another idea of how It's going to be gradually coming out of it. And then if we go to the next one, James. Again, this is continued telework, returning to work in phases when we can do it. We got to eliminate common areas in work. And we've seen this a little with some of our essential businesses that are open, and we've been tough on them to obey the guidelines. They've also been right that at different times in breaks, sometimes it's on us. Sometimes, we're working and we're not quite happy that there isn't more done on the social distancing, and then we get a break and we all come together. Again, we can't be doing that. Special accommodations for those in the vulnerable population. This is going to be tricky. We got a lot of laws that are out there on this, but if your workforce has a number of people that are in this, think about the accommodations that you could make to protect them. And let's just go one more, if we can, James. One. I just wanted to point out that even in that opening, and even with the White House guidance, when we get here, they're still saying school and youth activities can't do. They're still talking about bars can't do, though there's certainly some openings there. We'll talk through 2 and 3 at a different time, but I thought this was just a real opportunity to talk through their plan, because again, I think we should be united as Americans. We don't disagree with just about anything in here. I mean, it's a good public health document, but understand first we've got thresholds we've got to meet, and then the reopening will be gradual. And as we've shown you, there are very specific things that you can now watch, like the numbers over 14 days, like our testing capacity. We're going to be spending significant dollars from the CARES Act on the contact tracing, and there are things that employers can start doing right now to prepare for what we will eventually be able to do. You want to add anything before we go to?
No, sir.
Okay. So based on that, based on some shared principles with other states, Dr. Stack and I wanted to show you what we consider some of our major benchmarks in Kentucky. This is a big part of our plan for reopening, about what we are watching and when and what will guide us on when we can do what we can do. Number one, pretty simple. It's the number and rate of new cases. White House talked about the 14 days. We actually think that's pretty decent. This will fall directly on Dr. Stack as our Commissioner of Public Health, looking at the data.
And so for that, just to remind you, we want to look for a 14-day downward slope in the cases. That's a long enough duration to feel confident that it's not a just day-to-day variation, but a real trend.
Okay, number 2, and again, this is coming as where we were. It's also in the White House guidance, our testing and tracing capacity. Now, I believe that there's some that there's some misinformation out there on the testing capacity versus reality, right? So we got 15 rapid testing machines that I think Abbott manufactures. Those are 15 machines. That's great, but we only have 100 kits that can go through them, right? So the reality there is you can only test.
I got to make it a little better, but it's 120 kits.
It's 120.
So we got 1 kit per county, so we can test 1 resident per county in a state of 4.5 million. Now, we did get 96 more kits, so it's a little bit better.
So our job and what we're working on, and we welcome any help from the federal government, because again, we're bidding against every other state, we're bidding against other countries, is to take our testing capacity and to boost it as much as we can. And admittedly, Kentucky, we're at a little bit of a disadvantage. We don't have a major national lab in our backyard. I think New Mexico has a big one there, and a couple of other states do too. Now, what we've got are some amazing entrepreneurs and universities that are helping us. Where we are today versus where we were 3 weeks ago is significantly changed because of Gravity Diagnostics, U of L, UK, Solaris, and a number of others that are out there. But we're going to have to see increased capacity because, again, as we increase those contacts, as we reopen the economy, we need to be able to test a lot of people to make sure that we can step in and intercede.
And we need different types of tests. And we won't dwell on this today, but there's the ones we traditionally use where we use the regular labs and it takes a few hours on the machine. There's the Abbott rapid test. We need a lot more rapid testing capacity, so you can just go in for a procedure, get a test, and they can approve you in 15 minutes. And then the immunoassays that some are working on are going to be very, very important in the weeks and months ahead.
All right, so next is PPE availability. I feel like the last month of my life has been trying to buy PPE when it almost doesn't exist. We have had much better luck. We think that there are some positives in the market right now, though we certainly need them to be better. We just received a number of N95 masks from FEMA. It's not in the 100,000, I think it's about 80,000 or so we got, and we definitely appreciate that. This has two parts. This is both PPE in our healthcare system, which will determine how quickly we can open up other areas of the system. The reason we shut down elective procedures and a number of and other things are, I guess, two reasons. One, the honeybee, which you talk about, but number two, that so many of those take PPE.
Right. So when we start to think about opening up a little bit more from where we are, again, it's not going to be what we went into this with, because we're going to have to make sure there's enough of this PPE. Now, remember, there's a couple reasons for that. One is we have to keep the healthcare workers who are treating patients safe. I think we have an ethical obligation to do the best we can to keep them safe. But we also have an ethical obligation to keep you, the patient, safe. And so if you go into a hospital to have a simple procedure, you should not leave with the coronavirus. And so we have to make sure we keep both the healthcare workers and the patients safe, and the personal protective equipment is the way we do that.
All right, next piece is ability to protect our at-risk populations. So we got to think in every step that we take, how many of those contacts are likely to get into our senior living facilities, our prisons, and any one of our jails, those types of facilities where people might be vulnerable for different reasons.
So every day now, the team that I supervise and myself sometimes are involved on these calls, we are learning how, in a new world, to better support these vulnerable populations so we can intervene quickly, contain the disease as rapidly as possible, and help keep people safe. We're going to have to continue to get much better at that, because we're going to be doing it throughout the rest of this year as we keep people safe.
All right, next one is ability to social distance and comply with CDC guidelines. And this is when we're looking at specific businesses or areas and how we open up. It may be some like barbers, where there is or hairdressers or salons. My wife would have corrected me if I would not have there. That may have the ability to limit, especially customers and other ways. And I don't mean to use that as an only example, but they're just every industry is very different. We're going to be getting proposals and seeking proposals for review from this area. And our new normal is that things are going to be able to open faster if they're able to really strictly comply with the CDC guidelines. I mean, some things like a major sporting event with lots of fans this is going to be harder than something where there is more control. Anything on that?
No, and just to remind you that the governor had said he's going to work with industry to create groups so that the industries can help participate in this process. And so that will be work that will fall to other members of the team working with the governor's team going forward.
Absolutely. We want to both get what the industries think that they can do. That may be working through their associations and others. And then we may have to push back a little bit too to better protect people. But I think our industries, our areas are hungry for that dialogue and to see and listen. I know everybody's committed to doing the right thing, so I hope that's a really constructive conversation we can have. It's been very few groups that haven't been 1,000% on board with this. It's been humbling and amazing to see. All right, next, 6 is our preparedness to deal with a possible future spike. Can you put up Philadelphia versus St. Louis? We have. I know this is ingrained in your memory now. Somebody actually sent a stained glass Philadelphia versus St. Louis to me. In the time that's coming up, remember, Philadelphia is just that peak and it's gone, but then let's look at St. Louis. Look, this is a future spike. So what we don't want to do is we come, and we've plateaued, I hope, that we won't see the first round curve, but as we come out of it and down, that we don't have the resources and the preparedness that we've worked so hard to have. If there is a second later spike, we're seeing it in Japan.
Correct. And so if you look at these various public websites, but there's one that's COVID-19 spelled backwards. And if you find that website, you can search by country and you can see Japan was plateaued, which is similar to where we are now, we hope, and then eventually going down, but they started to climb upward. That's the second peak that you see in the St. Louis graph here. And remember, the second peak killed more people than the first peak. So we want to make sure we don't have a big second peak, even though the overall total is lower.
And we can go back to our benchmarks. The last benchmark, with one kind of guiding principle on top of that, is the status of vaccines and treatments. Obviously, this is out there. The closer we get to a vaccine or a very effective treatment, that can change the world in a moment. And we're certainly encourage and want somebody to get there as quickly as possible. That's how we get back to something more resembling our old normal than just living in our new normal. But under all of this is the important proposition that we got to be fluid, we got to be flexible, and we got to be ready to make adjustments.
Right, and so just to remember, the vaccine won't be till 2021 at the soonest, so that's going to be next year. Some of the early treatments people had hoped about are turning out so far not to be very successful, but then there are other treatments that are showing more signs of success. So we have to be hopeful that our scientists and our medical researchers are going to come up with some innovations that can help us. And then as we go forward, if we see the disease starting to creep back up, we're going to have to learn ways as a society where we can take steps to tamp it down real quickly so we don't have to go back to more severe measures.
And we think following these benchmarks, and we've walked you through now who our team is that we're working with, or at least getting guidance from. We've walked you through all of the White House guidance, which is in line with our thinking, and we have given you the Kentucky-specific benchmarks. Now, we believe, given that possibly even before May, we'd have some loosening in the healthcare area, depending on how the PPE is, that there may be some loosening in the earlier part of May, but it would be very targeted in what we're looking at right now. We think it is probably more realistic to give you an update on meeting those benchmarks that the White House has given as we come into May. And I'm hoping that we will make a lot of progress towards that as we're going through. And while I admit that that is not a date certain, I hope it does give you what we're looking at, where we need to be, and again, that I hope we're looking at least until we can do some things, weeks, but that we see the ability to really start opening up in some small ways, maybe leading up to May, and some other small ways in May, and then have a lot more optimism as we get towards the end of it.
I comment about healthcare specifically just for a minute. Thank you. You've done a wonderful job following our requests that if you have minor illness to stay away from in-person services and use telemedicine or the telephone. So thank you. I do want to say, if you think you're having a heart attack, you think you're having a stroke, you think you have appendicitis, please contact your physician or seek medical care. All along we have said that, and I think people's concern, rightfully, to avoid the coronavirus has had some perhaps stay away when they should have sought care. So use good judgment, and if need be, contact your physician for guidance on the phone. And as we open things up gradually, remember, telemedicine, telehealth, just like telecommuting, is going to be a new part of our lives in a way it was not before, and not everything is going to resume like it first did. We're going to have to prioritize the backlog of patients who have more urgent conditions who need to get in more quickly before we return to more routine things.
So with what we have done today, both telling you about our partnerships, going through the White House guidance and our analysis of it, showing the things that they say that we need to hit, showing you our benchmarks, which is what we have to hit on our planning side to do things. I think that we have provided certainly as concrete of a plan about the when and the how as you've seen from any other state. But we're going to provide more than that. We're going to talk early next week about our internal teams and how we hope our communications go, because it has to be driven by public health. But what's possible inside an industry is within that industry's knowledge. And so we want to make sure that we get their thoughts and their plans about how well they think that they can fall under those CDC guidelines, and then let public health evaluate with these benchmarks, again, how safe it is and when we can do it. Because there may be a group, I mean, there's 7 different benchmarks. There may be a group that can follow the guidelines pretty well, but their people may be connected more so, given the industry or other factors, to our at-risk populations. So it's a little more complicated than just putting them up here, but these ought to give you some real concrete ideas and examples of what we're thinking through. Now, I know we've gone a little bit long, but we'll do 10 minutes of questions, even though I'd previously promised we'd get out of here in an hour. To those that's really important for, I did try. So we've got, I think, 4, that's right, of our reporters here. We've got Karen Czar from WUKY, Morgan Watkins from the Courier-Journal, Mike Valente from Lex 18. Mike, I do know who you are. And Phil Pendleton from WKYT. So I'm going to go from left to right if I can. Morgan Watkins.
So you mentioned, I just wanted to clarify that we might see some loosening specifically of restrictions on healthcare this before May, but in terms of loosening restrictions on things like businesses or the broader thing, can you talk a little bit about that?
Yeah, the question was about clarifying some of our timing. We hope on the healthcare side that there are some things that we can do potentially even before May, because we got folks coming into the ER that are sicker than they would normally be because of the inability to see some of their providers, provided we have enough PPE, and that's critically important. We want to make sure that we can get people healthier, and that's part of it. I will say, I don't think we're ever going to have the same normal with the success of telehealth. We have seen I don't want to call it an explosion, that doesn't sound positive, but we have seen some really, really positive work with telehealth, and I think that's going to be pretty important going forward, just generally. What we see with other businesses and industry is we hope as we move into May that we'll be able to make some steps even in early May. With a lot of the broader industries, we're going to need more of a back and forth. We're going to get our testing where it needs to be and our contact tracing. So it's going to be a work with us as we meet the prerequisites, which, again, under the White House plan, you got to meet those prerequisites first. We're going to be working on that, but that gives us the time to make sure that when we have that opening up, the businesses are ready to do it in a safe way. So I expect a little bit in the healthcare, maybe even April, some steps in early May, though I don't want to build expectations bigger than they ought to be. And as we move through May, I hope we have progression, especially as we get testing ramped up. But again, we got to meet all those prerequisites, and whether states right now loosen things or not, I don't think anybody meets all of those prerequisites right now. So, I mean, just one, let's point out again, is 14 days of declining results. So we haven't seen that yet, but that's something that everybody can watch, and it'll give us a good idea. Karen.
Governor, in looking at these benchmarks, and I know you'd like to go in increments, but do you see in-class learning possible for the rest of this year?
Questions about in-class learning for the rest of the year. You must have noticed phase 1, even in the White House's recommendations. I want to wait to speak to the superintendents on Monday before I make a recommendation there. I think that the White House guidance is pretty telling on that. One question that came in, we received a couple of questions and concerns about Ridgewood Terrace, a nursing facility in Hopkins County, number of cases and quality of care there. Hopkins County has been hit so very hard. And while there are probably a number of causes on it, it shows, again, what any mass gathering, anyone, can do. So long-term care facilities have been one of our major concerns from the beginning. State communicates daily with these facilities through the state. This facility in Hopkins County has 31 positive cases and 4 deaths. And it may be 5 by the end of today, but that would be announced tomorrow. Ridgewood has asked CHFS for assistance. A response team has been deployed to the facility, represented by volunteer medical students, we talked about that yesterday, of UK's College of Medicine, who are supported by certified nursing assistants. Registered nurses will soon arrive to offer more support. Mike.
How many people would you need to hire to do the contact tracing?
That's a great question.
You're not going to ask me for the answer. I
So the question is, how many people do we need to hire to do contract tracing? And the answer is a whole bunch. And we're looking at models of that right now about where and how they'd be hired. But across the state, I would say that number is over 100, certainly across the state. I mean, this is going to be, until we work out of this, something critically important. And I think a number of dollars from the CARES Act that we're getting to address this virus is going to go into additional staffing. We're working on models right now. We'll come back with what we think is a firm number based on what we need, but also the resources that we have. Phil.
You got the 2 hospitals, I guess, nearly ready, but based on what you've said, are you thinking now you may not even need those, or what's the status of that?
So the question is, with the field hospitals ready, I believe both, if they had to, could take patients today. That's a credit to UK, and that's a credit to the National Guard and emergency management and public health for the one in Louisville. Do we think we will need them? Again, we are in a pandemic that we have never seen before. We have seen spikes in other states where very quickly folks could be overwhelmed. I'm now thinking that is less likely than the nursing home or skilled nursing facility that has just a real immediate need. And what do? Right? Do you potentially sit on the phone for 12 hours? Where's the options, Dr. Stack?
So that, again, I want to emphasize, I think we've tried to be very careful this whole hour tonight about normal going forward is not normal going into this. And so when we start lifting restrictions, I want to be very clear, there will be more disease. More people will get infected. That will run the risk of people getting very ill and some people dying. There's a counterbalancing need with people's need to go on with life and people's need to be kept safe. We've recognized that all along. Those field hospitals, we hope we never have to use them. But the fact that this disease will still be with us until we find a vaccine or a way to cure it quickly so people don't suffer harm means we're going to need facilities like that available should this take off in a way we hope we don't ever see.
Morgan.
So it sounds like in terms of the phased reopening that, at least for right now, you're really relying a lot on the White House plan as kind of a blueprint for what steps to take and when.
So the question is, in what we're doing right now, are we relying a lot on the White House plan as a blueprint? I would say that those benchmarks that we had written before, and the White House's plan came with pretty much the same ones. And that's because they're being driven by public health. And I appreciate that on the federal level, they're being driven by public health. They're sure as heck being driven by public health on the state level. That just means we're all on the same page. And I look beyond any of the political back and forth when you actually get down into the meat of the guidance and the recommendations. We're all on the same page for what and when it's possible. And I'd say don't just listen to the good stuff, what makes good TV or good print. Actually look down into the plans, and you'll see just about everybody agrees on the steps we ought to take. Karen.
Dr. Stack, a lot of people have asked us, what is considered a good supply of PPE? Because we don't understand potentially, like, per day what would be needed. So let's say we got nothing in, right, from this point on. how long does the PPE that we have with that last?
Right, so I'm working with the healthcare community for us to try to come up with this. So remember, before this all happened, so if you went to just January of 2020, a lot of these hospitals worked on 3 to 7 day just-in-time supply chains. They ordered stuff, it was continuously coming in. They didn't keep lots of inventory on hand. Now we have to live in a world, so we never had to catalog it this way at this scale. Now we live in a world where they're going to have to keep on hand what they need for their 3 to 7 days of operations, and I anticipate there'll be a need for them to keep a separate supply on hand in case there's a surge. But we're in dialogue with them. I'm in dialogue with them to try to come up with something and benefit, like we will with every other industry, for what they think is sustainable and reasonable, and we'll try to find something we can all mutually agree on. But right now I don't know, but when we come up with that, we'll be happy to share it.
And I think this country has learned that the ability to domestically produce / manufacture PPE and to store it is an issue of national security. I don't think it was considered that before, but it sure as heck is now, and we got to make sure going forward that we have what we need on hand, because it now seems like things that only happen every 100 years happen a lot faster than that. Mike?
I have another question for you, Dr. Stack. We've heard a lot about hydroxychloroquine, but today the NIH is saying that remdesivir is showing a lot of promise. What are your thoughts on remdesivir versus other antiviral therapies? And also, do doctors have broad discretion to guide or provide remdesivir to their patients?
So I'm grateful for that question. So I think one of the things.
Can you repeat it?
Oh, yes, I apologize. The question is about various treatments. There was enthusiasm, and the example was used with chloroquine or hydroxychloroquine, perhaps not being shown to be as helpful, and now remdesivir, which is an antiviral, and excitement and enthusiasm about that. I would have to broaden this. I would say we follow what the research community and science community does, and of course, if we find things that are proven, we will share that and disseminate that. The Department of Public Health is not in the business, though, of doing fundamental research and therapeutic development. That's the Food and Drug Administration and the research scientists. We will recommend things when we feel the level of confidence that they work justifies recommending it. I think you heard the science, the medical community hesitant to endorse some of those other treatments early on because the evidence was not yet there. And I think we're finding some of those treatments aren't in fact going to be supported by evidence. Hopefully remdesivir works better. Hopefully immunotherapy works better. Hopefully we come up with even more treatments going forward, but it's too early to endorse any of them. They're all still currently in research stages.
Last one, Phil.
Based on what you said about the vaccine next year, should Kentuckians be prepared for basically some kind of restriction being in place for the next year?
The question is with where the vaccine is, and I don't think any of us really know, except that we really hope, and we really do hope, should we expect to be in any type of position like this next year? I'm going to give my thoughts, and then we'll turn it over to somebody who knows a lot better than I do. I think that if there is not a vaccine by this time next year, first of all, the world will already be very different. We'll still be engaging, if there's not one, in social distancing, not to the extreme that we are right now. We won't be in full healthy at home, though I hope we're always healthier when we're home after this. But the way we work is going to be different. What we do in public is going to be very different. The way we socialize is going to be very different. And so just with a new normal, you would not see first, I think, the same spread because we'd be in a different place. But I also think it would be turning the key to stopping an increase in cases would be a little easier, even though it certainly lags in time. Significant additional testing capacity, ability to trace contacts and immediately quarantine. That's something that none of us have lived through, but it would be very different than what we've lived through right now. I think while if there's not a vaccine next year, we'll still be dealing with this. The way we deal with it will be vastly different, and the disruption to our lives will be significantly less.
I'm just saying I'm grateful to work for a governor who does most of my work for me, and I don't need to add anything further.
I'm glad to have a commissioner of public health that has been patient with me and has helped teach and guide me. All right, folks, I know we went long, but I know that you've been anxious to see what's going to guide us and how we're going to go. I think with this, we've provided you with more information and transparency, which has always been my goal, than just about anywhere else. I will always answer your questions and answer them honestly. We are going to work hard to reopen our economy. Nobody wants to eventually move to a period of time where we're not announcing deaths every day at 5 than me. Let's just make sure that we do it smart, we do it safely, and that's what everybody out there wants, including our business communities and others. You have sacrificed so much. You have not just flattened a curve, you're going to create something that we can't even describe probably as a curve by the end of it. What you have done is special, and I believe it's going to be historic. So let's make sure that we are resilient as we are working to slowly move out of this, that we don't let our guard down, that we don't start focusing on the next game until we win this game. Lives are depending on it, and I know you're up to the challenge. Finally, remember, even with all this information out there today, we lost Kentuckians today. Their families are going to be mourning, and let's make sure that we give them the respect. Our flags are still flying at half staff because we've lost over 100 Kentuckians. Let's make sure that we light our houses up green, ring the bells at 10 o'clock tomorrow. We're going to end with a little video, a little inspiration for all of us. We need to keep our spirits up to make sure that we win this fight. We're going to get through this. We're going to get through it together.
Yesterday is not ours to recover, but tomorrow is ours to win or lose. Lyndon P. Johnson.
Imagination will often carry us to worlds that never were, but without it, we go nowhere. Carl Sagan.
The world is now too small for anything but brotherhood. Proud David.
We are
Team Kentucky. Stay healthy.
at home.